All right, it is the top of the hour, and I see we already have about 150 people on to give you a great sense of interest. I think we'll go ahead and get started, if that's all right with everyone. Great. So let me just say that to all of you on the line, both those panelists and all of the attendees who are signing in right now, good afternoon, good morning, good evening, depending on where you are around the world. My name is Mitchell Warren, and I'm delighted to welcome you on behalf of a number of organizations, including WACI Health, and you'll meet its executive director in just a minute, as well as Friends of the Global Fight, and you will see and hear their leader shortly. Our organizations came together along with many other partners over a number of conversations related to the emergence of this new pandemic that has defined, I think, all of our lives over the last 7 months in ways that, although I think we all knew pandemics would come, I don't think any of us quite knew how significant the last 7 months would play out. One of the things that a number of us in the United States have noticed is the incredible leadership of the African Centers for Disease Control, as well as national governments and communities on the continent doing a remarkable job in dealing with COVID, and also recognizing that no pandemic is on its own, and the intersections with other pandemics, certainly HIV, TB, malaria, and many other health and development and rights issues. And really wanted to create a platform for a conversation amongst all of us. As I said, my job is purely logistics and introductions. In just a minute, I'm going to introduce a panel and give you the run of show. I do want to encourage everyone to list your questions. You'll see, and I think for better or for worse, many of us have too many Zoom call experiences over the last 7 months, but many of you will know there's the chat feature, as well as Q&A, and really want to encourage those attendees to enter questions into the Q&A function as we go. We'll monitor the chat feature as well, and I suspect we won't get to all the questions in the next hour. And WACI Health, Friends of the Global Fight, and AVAC are certainly committed to keeping this conversation going and addressing any questions that come. So we will do our best to address them all as we go. I am in just a minute going to turn it over to a dear friend and colleague, Elizabeth Bukusi, a leading researcher based at the Kenyan Medical Research Institute, KEMRI, but is a global leader in research ethics and in the intersection of research and community engagement. She's going to moderate a discussion with two of executive directors of organizations that are really doing remarkable work. First, John Nkengasong, who over the last 4 years has taken on leadership of the African CDC and has really, even before COVID, positioned it as a global leader that is based in Africa, and certainly over the last several months, we've seen that, and looking forward to hearing from Dr. Nkengasong. Also delighted to have the executive director of WACI Health, Rosemary Mburu, who is a champion on so many issues in health and rights, and really excited to have them in conversation with Elizabeth and with Chris Collins, the president of Friends of the Global Fight. In addition, we are delighted to have Lwazi Malaba, who's a Global Fund champion working on HIV, TB, gender-based violence, based in South Africa, himself a COVID survivor, and I should say, really excitingly, a founder of the African COVID-19 support group. And if there's anything we've learned in HIV, it is the importance of leadership from people affected and infected with any of these diseases we talk of. And Lwazi, delighted to have you joining us on the line as well. That conversation will unfold over the next little while, and then I'm delighted that Maureen Luba, my colleague and friend at AVAC, and who is our Africa Regional Advocacy Advisor based in Malawi, is going to moderate the discussion further, integrating the questions that come in from all of you on the Q&A feature. Let me just say at the outset how grateful I am to have several hundred of you dialing in, and particularly to have this remarkable panel of leaders, and I'll turn it over to you, Dr. Bukusi.
Thank you very much, Mitch. It's such a great honor for me to be part of this conversation. And it's such a privilege to have both Dr. Nkengasong and Rosemary Mburu with us. And maybe I could just start by asking Dr. John, I mean, there's so much good that can be said about you, and your CV is amazing. And if I start saying all the good things about you, it might take so much time. You might not have time to tell us about the status of COVID-19 in Africa right now and its impact. So maybe we could start with that. If you would kindly just share with us, what are your thoughts on the status of the impact of COVID-19 in Africa right now?
Thank you so much, Elizabeth, and Chris and Mitch. It's good to see you all again. I think Mitch and I go a very long way in our battles against HIV, and a battle that is still going on. HIV is still a pandemic in Africa. I think we should always remember that. I start with that because the harm that COVID-19 is currently imposing in Africa and the world is generational. I think it will be generations to come before we truly size the impact of COVID-19, both in human lives, the economic loss, and the destruction that is going to have on our health systems that already are very fragile. So in terms of the harm, the human harm is numbers. I really hesitate to keep throwing out numbers, because my fear is that sooner or later we'll begin to, these numbers become statistics, and they cease from being human lives lost, and that will be a tragedy, because the loss of one life is extremely painful. And when you you throw out numbers, they're like globally close to very soon we'll be hitting 1 million deaths. And in Africa, people say, well, your numbers are very low, it's 32,000. Excuse me, it's unfortunate, because it's 32,000 lives lost, families, friends, loved ones, and the engine of our future development is what is at stake here as a continent. So I think the harm itself, the economic, the human life, the loss is a tragedy. 1.3 million cases reported in Africa, 32,000 deaths. Good news is 80,000, 80% of those, about 1 million people have recovered on the continent. I think that is very important. The other good news to share on the continent is that based on the available data, you see for the past 4 weeks, we've seen a slow decline over time. It doesn't mean we are out of the wood, but what that tells us is that what we are doing as a continent is working, I think, and we should only intensify that, increase that, and not be distracted. I think Mark Twain once said that we should avoid to distract from being distracted. So I think with no distraction at this point, we should really stay focused and make sure we intensify our efforts to increase ability to test, ability to do contact tracing, the ability to isolate, very importantly, the ability to mobilize the community. This fight will be won or lost at the community level in Africa, where we build trust with our community, and that the currency of that trust will be the ability to share good information, timely information, and accurate information with our community, so that they lead, they respond, they engage, they take the leadership in engagement, in owning the response, and cooperating with all of us. So I think that is very important. The second area of impact we're going to see and already seeing is the effect on HIV/AIDS and tuberculosis and malaria. Clearly, the combination of those three leads to about 1.2 million deaths a year in Africa, and that is significant. And the disruption that this virus has created in a very short time will be felt for very, very long. Again, we should always remember what the continent was going through in the early 2000s, where our life expectancy in many countries was going down before antiretroviral therapy came in, and then we started bringing back the curve, and it's still around. I mean, we, as a continent, we record about 1 million new infections of HIV every year. That's a lot. I think it tells you that we were never going to meet our 2030 goals of ending HIV or controlling it, but now it will become even more complicated for us to get to that number. Lastly is of course, the economic impact. To imagine that the continent has been grounded for close to half a year is unimaginable. I think we are the economists I'm working with every day, the Dr. Vera Songwe, the Donna Kaburuka, and others are saying that we need about $150 billion as fresh monies to inject into the economies to bring back our economies there. I think we don't have the amount of money that the United States or European countries have that are infusing into the economy. We just don't have that. So the harm that this is going to create for us is just tremendous. So I think those are very different areas of the impact that I can imagine that this is creating us, besides the impact on education, that most of our schools are still closed. It's a remarkable thing that I didn't know as a virologist for 32 years that I will live to see the effect of a virus impacting our educational system. And that means generations and generations to come, the impact will be felt because of the lack of education of our children. Thank you.
Thank you so much, Dr. John. You've highlighted some really important things. For many of us, perhaps working in the scientific world, we can even talk about working from home. I know there's so many individuals who, because their work depends on going on a daily basis, the issue of working from home does not even arise. Rosemary, from where you sit, sometimes I've heard my fellow Kenyans even say, this COVID story, especially right at the beginning, they were saying, is this real? Is it just government trying to make us stay at home or do something different? Would you shed light for us? What do you see as the impact? And maybe also just speak about what have you seen about the programming for HIV, TB, and malaria? What impact has this had?
Thank you so much. It's a great honor to be in this conversation, and especially looking at COVID-19 and the impact it's having in our region. I think there are two areas for me. One is around the economic impact that has been mentioned, as well as the disruptions to health services. In terms of the economic shocks, we do know that when COVID-19 happened, the worry was that our region is already in fragile mode in terms of the health systems. And also in terms of GDP, just looking at what was happening elsewhere in the world, the fear was that COVID-19 is now in the region, we have weaker health systems, and we also have countries with much, much, much lower GDP. And that was really a worry. And we then also saw World Bank projections, which really worried us, saying that COVID-19 is likely to push about 70 million people into extreme poverty. And with that, then there is a realization that a majority of those 70 million people would most likely be in our region. And so just understanding the situation and the impact as had been projected was a position of fear and a movement of fear. But then also, we have seen people we know getting infected. We have seen a devastating impact. And so what we see as economic shocks, we have seen on the ground, people losing their jobs. We have seen on the ground, education systems being disrupted. We have seen on the ground, nutrition interventions being disrupted. We have huge issues around sexual and reproductive and health rights on the ground. So just being on the ground, being in countries where you experience, and this is actually, all over the world, but I think the fear we came into this, given our already fragile state as far as health systems is concerned, is also something that really worried us, but also, I think, sort of prepared us and made us to get into this with a lot of resilience. I think also what we have seen in Africa, given the other epidemics and pandemics, including Ebola, has sort of mentally prepared us to attack epidemics. I think the difference with this time is Africa CDC was not there previously. And when COVID-19 happened, Africa CDC had already been created, was on the ground. One of the very important things that happened with the presence of Africa CDC is the coordination of a continental response, which is something to celebrate, even as we look at the impact. I think that's something that as an African people, as a region, is something we are proud of, and we applaud that leadership. It hasn't been easy, and it hasn't come without challenges. There have been challenges. And so I think just looking at what has happened on the ground, appreciating the challenges, and seeing the real effect have really been quite a journey. In terms of HIV, TB, and malaria, we have seen the disruptions. And not just HIV, TB, and malaria. We have mentioned that the disruption of essential health services within our health systems is something that has really been real. But when you look at HIV, TB, and malaria, UNAIDS report has projected that COVID-19 impact could take us back 10 years of the gains we have made so far. The latest Global Fund status on COVID-19 and impact on malaria has also mentioned 10 years in terms of how far it can take back the gains. If you look at TB again, it is the same thing. Only yesterday, the Action Global Health Partnership launched a report looking at effect of COVID-19 on TB. And within that, you see that about 50% of the healthcare workers who reported are reporting this disruption of services within TB systems. And so there is evidence on the ground in terms of research that has been done, but also in terms of real interaction and engagement with people who have either not been able to access HIV services because of stockouts, people who's been affected by delays in mosquito nets, people who've been affected by disruption of TB services, or diversion of healthcare workers into other programs. So we have people who have real life experiences, and that's something to note, that's something to appreciate. Even as we applaud and celebrate the African leadership, as everybody was navigating this space without really knowing exactly what it was in the beginning and figuring that out, we also want to acknowledge that there have been some lessons that we have learned. One of the lessons I think we have learned is that we cannot win any global health fight without communities, and communities have to be at the center of the response. I think we have learned that with every epidemic, we have learned that with every pandemic, and COVID-19 is teaching us that again. Not every African nation puts communities at the center. And so that's something that we need to take care of. The next lesson I think we have learned is that for us to win this, issues of human rights protection, gender issues or gender barriers, issues of stigma and discrimination have to be addressed and have to be part of the response. And the other thing is, we're also learning that we actually need global solidarity to win this. We know that the global health security is only as strong as the world's weakest health system. And therefore, in Kenya, we cannot pride to actually be defeating COVID-19 if our neighbor in Burundi or Rwanda is struggling with the same. And that also goes beyond the borders in Africa. And I think the lesson around us needing to unite to fight is a really strong lesson, that we need to join our hands, we need to partner, and everybody needs to work on this if we are going to win this. So those are my reflections on the impact as well as some of the lessons that we have learned.
Thank you so much, Rosemary. Now, as a researcher, I would be remiss if I didn't push us and think about the research agenda. Dr. John, let me come back to you, a biologist of over 30 years, never having imagined that you'd live through a pandemic like this. What's the role of African researchers? And especially now when there's been a lot of negativity and all kinds of information on social media around vaccines. What's the role of the researchers, and how would we ever be able to support and ensure that even if there are vaccines, that they can be rolled out, that we can support not just the research, but the opportunity to be able to roll out something like a vaccine that would be useful. How does Africa harness the technologies and to make sure that it works for us?
That's a very good question, Elizabeth. We have to come out as a continent from this crisis better than we went into the crisis. And this has to cease from being a rhetorical call to action and really becoming a reality. And we need to act on those things that are called the known do-nothing gaps. And what is the known? We know that research is investment. That we also know that no country in the world has ever developed without investment in research, period. And Africa has to take that leadership role and look inward, first of all, and say, how are we going to build research capacity that will feed into development of diagnostics, feed into development of vaccines, and feed into the development of drugs? All three elements are critical to safeguard the continent and ensure the security of the continent. Recognizing that when we talk of global health security, there are three levels of that security. One is national health security. I mean, you don't think of global health security if national health security is not guaranteed. If Kenya cannot guarantee the health security of its people through investment in research, it then is needless talking about global health security. And that Kenya cannot talk about only national health security. It has to talk about the regional health security, which means that Africa as a collective must bond together that and recognize that what COVID-19 is teaching us early is that we are more vulnerable than we thought, we are more connected than we thought, and the equities are available all the time. And that if you strengthen national health security, regional health security, it fits into the global health security, so that the whole discussion about global health security becomes a reality and not just another nice public health word to put out there in a generation. I think, how is that related to research? To do those things, we need to invest in research. I hear there's a lot of discussion now about local manufacturing of drugs, diagnostics, and therapeutics. It is only through research, R&D, that it will empower us to do those things there. You don't just wake up in the morning and say you want to produce drugs or vaccines. Those investments have to be there already in place, and through investment in research, recognizing that the benefits you don't develop if you don't have appropriate research capabilities. So there are three things that always end a pandemic. One is, do you have the right diagnostics? And if you have the right diagnostics, can you produce drugs that can treat people? And if you can produce drugs, can you produce vaccines? And all of that, Elizabeth, you agree, requires research, that you have an active research portfolio going on all the time. And the best way to prepare for the unknowns is to invest in the knowns. The knowns are the things that are challenging us every day. That is the TB, the malaria, the HIV, those diseases that are restricted, the chikungunya, the dengue that you don't see in the West. I mean, that you fight them locally. The plague is emerging and re-emerging there. So we develop those research agendas around that. And the day that you are challenged with a threat like the COVID, then you launch that into action. I'll say this and then I'll end here. When COVID hit the continent, Elizabeth, there was no laboratory in Africa that had laboratory in Africa that had the ability to test for COVID. We had the capacity, very good labs like Kemri and others, but just the reagents. But guess what? 2 weeks after the virus was recognized, the sequences were known. And it was very easy to take those sequences and then through our R&D research mechanism, develop assays that could be used locally. But it would take us not up until mid-May before we really started having access to diagnostics there. That is the effect of diagnostics, research, that not having appropriate research capabilities. We should always remember this as a continent, and Mitch can testify to this because he was a foot soldier in that fight, that Antiretroviral drugs were available in 1996 in the West, and death rates plummeted. It would take 10 years, up to 2005, before the death rate started decreasing in Africa because of PEPFAR, a global fund. Why? Because we didn't invest in research and development to make our own drugs locally there. That exercise or that occurrence should never happen again in the history of public health or a global health again. And it's all because we don't invest in research. I think I'll end by saying we need a new public health order for Africa that really focuses on those things that can promote research that will feed into vaccines, feed into treatment, and feed into therapeutics, and that would contribute to the overall health security of the world.
Very eloquently said, Dr. John. Thank you. I want to hand over to Chris, but before I do so, Rosemary, you've talked about community, really important in all the things we're doing, even if we're doing research and even if we are scaling up and making vaccines or whatever interventions available. Could you speak briefly about issues of policy and research from the community perspective? And then Chris Collins will take it from there and move us forward. Rosemary.
Yeah, thank you so much. And it's really great to hear from John, the leadership from the Africa CDC as far as research in the region is concerned, to hear the plans and all that. And one of the things that was running in my mind as I was listening to you, Doctor, is who is funding this work? It's very important work and we need to do it as a region. And I was just thinking about, oh my God, this is amazing. I really hope that we can get to have these African initiatives funded, both by domestic resources, but also by international resources through the international solidarity that we are speaking about. Coming to the question about community engagement, I think it's going to be very important to have a very concrete community engagement plan by Africa CDC if it doesn't exist. And within that community engagement plan, we hope that it can look not just at, it can look at vaccines, therapeutics, and diagnostics. Like how is Africa looking at putting communities at the center of even the research processes and really looking at communities as partners in the research process. It is very critical in the Africa region, especially if you pick vaccines, for example, the kind of narratives we have in the region where we have hesitation, where you have people who have hesitation around vaccines, et cetera, either in terms of utilization or even in terms of participation in research. And one of the ways that we need to build trust for this within our region is to make sure that we are listening to communities, to make sure that we are understanding what do communities need, what things excite them, how do they want this done. And that's something that we as civil society and communities can really support to ensure that a community engagement plan does exist as we continue to elevate Africa's research agenda that is African-led and that is going to provide solutions for Africa, especially because one of the other things and the concerns and the worries is that we really want to ensure that the global response and the solutions that come out of the different processes, for example, the ACT Accelerator, the products that must come out of that must be equitably distributed. So Africa must not access the vaccine 5 years after the rest of the world has accessed the vaccine. But how we get there is communities' involvement and also advocacy, participation, mobilization is really going to help towards that. And the other question is, when Africa accesses these products, are we going to show up and actually take up these products and interventions? And we won't know if we are not sensitized to understand what they are, what the science behind that is. And so that's something to work on. So Dr. Bukusi, it's really about how, as a scientist, how do you prepare me as a consumer to understand that this is the science behind these products and this is why it's important for us to take them up?
Very well noted. Chris, over to you.
Sorry. Thank you, Dr. Bakusi, and all our panelists. Already a wonderful conversation. And I wanted to start off with WACI, who's with us today and is the founder of an Africa COVID-19 support group, living with COVID-19 right now. WACI, can you tell us what that experience has been like and kind of your message for us in terms of what's needed in the response from your perspective?
Thank you very much, Chris, and all the other panelists. I'll begin by saying there are two stages that one has had to deal with. The time when you knew for sure that you had COVID, and it was intense, it was scary, you were unsure what was going on. You couldn't even believe that you were going through it, because for all intent and purpose, all of us did not even believe that it was real. And so forming the support group, for me in particular, created a psychosocial support system. I just want to begin by calling names of people that I know for sure have gone through this with me, so that it is not numbers we are talking about, it is people, it is lives. Cindy, Maza, Vuisega, Zooks, Nomkita, Rhoda, Steve, Tracy. And there's many others in the network that we are. We speak every morning and check on each other. Now we have what is called long haulers in our group. You wake up not feeling okay, you're not sure why. You're feeling extremely exhausted. You've had 9 hours of sleep. It is scary. And so in our conversation around what is high-level conversation and talk, we've got to remember that there's people who are going through this. And J.K. Rowling says poverty entails fear and stress, sometimes depression. It means 1,000 petty humiliations and hardships. Climbing out of poverty by your own efforts, that indeed is something to be proud of. And many of us have climbed out of COVID, out of our own efforts, building networks with each other. This is the time to do more, to give more, to help more, to be more compassion, more empathy, will make us more human, to avert more infections and save lives. We must therefore mobilize 5 billion for the Global Fund to keep on track. I have worked with the Global Fund for the 6th replenishment, and at that time we were saying step up the fight. That was before COVID. COVID came, and now we need to use another hashtag. We need to do more than step up the fight. The gains that have been made against HIV, TB, and malaria are now under threat. Raising 5 billion will help the Global Fund to support the countries that it helps, middle income and low income countries. But more than that, we need to remember that people on the ground need the support. The tried and tested Global Fund mechanism, which I know for a fact and have worked with, will help us avert many more deaths that are avoidable. So saving lives cannot be a political statement. It is at its most basic humaneness. I ask that we invest in community-led interventions. Since the beginning of COVID, and indeed throughout the HIV, TB, and malaria responses, it has been communities that have led the interventions on the ground. COVID again showed us that when crisis hits, communities are the first to sensitize people, to create awareness, and fill the gaps such as providing food and taking care of social ills. Much of this is unfunded. I ask that we ensure that communities are funded and have access to adequate personal protective equipment. Many of the people that I speak to every day have exhausted their medical aids for their own medical bills. This means they are now out of pocket for their support for long hauling. And so we need support. We need to avert more infections. We need contact tracing support and digital health support. We need more information on the ground. And that is where I come from. Thank you.
Thank you, Loazi, for sharing your story with us and those very moving comments, and really a call to action to all of us. I really appreciate it. And you've taken us into the next part of this webinar, which is talking about how the international community can partner. And I wanted to ask all of our panelists, starting with Dr. Nkengasong, thank you, first of all, so much for the incredible leadership you've shown during COVID-19. The whole world is seeing the great role that you and Africa CDC are playing. And I just want to thank you personally for that. But all of you have talking about COVID's impact on service disruption, on AIDS, TB, and malaria programs, the need for PPE to protect community health workers and keep them safe, the need to scale up testing. Need for scaling up testing is something Dr. Nkengasong just was quoted as saying just a couple days ago. What can donors do at this moment? Loazi's talked about the Global Fund and the services it can provide. What is needed from the donor community at this moment? Dr. Nkengasong?
Yeah, I think that's a very good question, Chris. Very good question. We started off very early in this pandemic that we need global solidarity to address a global solution that we are facing for the first time in about 100 years. The last time we faced this as a planet, none of us on this call was around. It was in 1918. Maybe some people were around, but I'm not looking at all your faces. I can't say that any of you were around. So this is a new day for us to learn and embed this. You can simplify this into really, truly global solidarity and global for a global solution. Yeah, I mean, clearly, in several layers, I think we want to recognize that the world has always been a safe place in terms of global health when the United States have exercised leadership. I mean, across the board. I think this is not a slogan, but that this is a fact. The United States stepped in with the PEPFAR program, and it completely changed the dynamics of health, of HIV, the impact of HIV in the world. I think that is, if you recall, the only resolution that has been passed at the United Nations for health, it was around HIV in 2001, recognizing HIV as a security threat. I think here again, we have a national security threat caused by COVID-19, and that leadership from the United States is very, very important. Second is a demonstration of that kind of translating that kind of solidarity into action. One of the greatest act of humanity that ever happened in global health was the creation of the Global Fund. The Global Fund was where human beings came together to, as a collection to solve problems that were affecting other human beings, whether they were directly infected or affected. They said, let's come together and solve a common problem. That coming together to solve a common problem is what is going to make us a single planet. And this is the time for us to think of a Global Fund 2.0, and where I will call for it to be transformed into a global disease threat fund, and not just a global fund for HIV, TB, and malaria. If you look at what the Global Fund has spent now to fight COVID, not HIV, not malaria, not TB, is significant. I think it tells us that that solidarity that the world exercised in establishing the Global Fund for HIV, TB, and malaria should be extended to a global fund that addresses such diseases. And if we have such a fund, what would it do? I mean, the issues that we are facing today of scrambling for vaccines will be addressed. I think that we're challenged with disease X, and the Global Fund for disease threat says, look, we have 4 billion in our war chest. We're going to use that to procure vaccines for everybody, so that when we talk about access and equity, it's not access to equity to the remaining vaccines, but it's access to equity to the vaccines that are available for everybody, and everybody can access that in a timely fashion. So I think recognizing, and just to end on this, that a threat anywhere in the world caused by COVID will be a threat everywhere. There's no two ways of thinking about this. If the United States, for example, vaccinates a section of its population, and then people move in with COVID, you start the struggle all over. I think there's just, and we don't know how these vaccines will work. We don't know if the vaccines will be like every yearly administered, or they will be like measles vaccines or yellow fever vaccines for so long. So the best way to protect ourselves is just that everybody who deserves to be immunized in the world has that vaccine, and then the world is protected. I think that is what I'm calling for, a true sense of global solidarity, similar to what the world has done to establish the Global Fund, a true sense of leadership, similar to what the United States did in establishing the PEPFAR program, which was transformational, and the contribution of the United States to the Global Fund. I think those are glaring examples of when leadership has swing into action and what the impact could be on humankind.
Thank you, Doctor. And you know, I would just point out, you've both now mentioned the Global Fund, and the Global Fund's COVID-19 response mechanism has actually provided hundreds of millions of dollars to countries around the world to shore up health systems and addressing COVID, address service disruptions in the AIDS, TB, malaria programs. Those systems will also be in place to get diagnostics out, vaccine eventually. That mechanism, the Global Fund's COVID-19 response mechanism, is running out of money this month. So for people that are in donor communities, it's really important to know Global Fund, all the good things you're hearing about that it's done, will not be able to do them anymore by the end of this month because countries have used the money that's available, and we simply need to get more donor investment into the Global Fund's COVID-19 response mechanism as quickly as possible. Rosemary, let's go over to you and this question about international partnership. What do we need to be looking for from international partners right now?
Yeah, so very quickly, I see three things. One is that right now we have the global plan to end TB, the global plan to end malaria, the global plan to end HIV. And those plans need to be adapted to also help responding to COVID-19. But adapting alone is not sufficient. Then they need to be accompanied by investment case frameworks that then donors, basically the international community, needs to come together and fund those. Number two, I think the world, the international community, needs to come together and fully fund the recovery mechanisms. The recovery mechanisms include what Loazi and you, Chris, you're mentioning, the COVID-19 response mechanism of the Global Fund. We want to recall that the Global Fund was the first multilateral partner to put money on the table, $1 billion that really was very useful at the country level to get countries to get started with the COVID response. And that mechanism needs to be fully funded. Other mechanisms also include like the political mechanisms with the G20, G7. There are various recovery mechanisms, and those really need to be funded. And the third thing for me is that we need to increase investments that go into supporting the capacity and coordination of TB affected communities at the center of HIV response, communities at the center of malaria response. And there are initiatives to that effect. Missing the people, finding the missing people initiative, for example, of the Global Fund and Stop TB Partnership, a civil society, the Challenge Facility, an initiative of Stop TB Partnership, and so on and so forth. You have the Community Rights and Gender Initiative as well, that really, when well supported, when investments increase into that, the partners are going to be able to support civil society coordination capacity in ensuring that the critical role that communities are playing also in ensuring that COVID-19 is adequately responded to is really done. So it's really about investing in this and looking at the different frameworks that, that exist. Thank you.
Thank you very much. And you know, you've pointed out that there's a variety of ways that donors can be supportive. Global Fund is one. You've named a couple others, certainly the U.S. bilateral programs. These are all ways that donors can help, but the help is needed for a vaccine available to everybody, but in the immediate term also getting the services, protection for healthcare workers, mitigating the damage to AIDS, TB, and malaria programs, all urgently needed. I'm actually going to hand it over to Maureen Luba, who's going to moderate our Q&A with the over 250 people who are watching today. We're really glad you're with us. You can post a question in the Q&A box, and then Maureen will call on as many folks as she can. And thank you, Maureen, and hand it over to you.
Thank you so much, Chris. And I just wanted to start by thanking Rosemary and Dr. really bringing out the issues that are keeping all of us at work at night. And again, thanks to WACI for bringing the reality about this virus, to the conversation. I entirely agree with the points made earlier on the need for us not to focus on the statistics, but rather put the human face, behind those figures, and the need for us to stay focused and intensify our efforts. And of course, the need for global solidarity, which is also coming out strongly. And lastly, but also most importantly, building that, community trust. It's great to see that there are a lot of questions actually that are coming in. Of course, we try as much as possible to respond to some, if not most of all. So without wasting much time, I just wanted to turn to the Q&A and bring out this question that came in earlier from Rebecca to say, what are some of the lessons that we are learning during the time of COVID-19 that would be useful for our work with all diseases, even after COVID is more under control? So maybe I will turn to Dr. Kingston to take that up.
I think there's several lessons that we can call it early lessons, because we still we just still have a long journey to go before we start truly understanding the lessons that COVID-19 has taught us. But let me restrict my comments to what we are learning from COVID-19. Unfortunately, so these are not new lessons. They are lessons that we have known before, but we neglected it. Maybe neglect is a strong word. I would say that we just didn't focus on it. I think neglect, at times when I use that, people say that it's a willful act to not strengthen our health system. But we've known that as a continent, we need 6,000 epidemiologists. But we currently have 1,900 epidemiologists. So there is a gap there of close to 4,000 epidemiologists that we have been needing before COVID-19 hit. We need 25,000 frontline workers. That is what you call the foot soldiers. That is people that you train, and then they can actually, within 3 months, they can at least do basic surveillance and monitoring work. We currently have trained as a continent only about 5,000. So there's a gap there of about 20,000. Our head of states have said, let's deploy, before COVID, none of this is during COVID, have said, let's deploy 2 million community healthcare workers to support our HIV, AIDS, and TB programs. None of that have been done in a constructive manner. Then that is clear. And now with COVID, we know that we need that in order to fight wage a strong war against COVID-19. So those are all things that we are learning. Secondly, we know that we do not protect our healthcare workers appropriately and adequately. COVID-19 has exposed that more. I think we need to invest more in infection prevention control measures, because the people that protect us need to be protected. And the people that protect us, unfortunately, are not well protected. That is our healthcare workers. I think we need to really focus on that a lot. The third lesson that we are learning from the COVID-19 that has to apply going forward is that COVID-19 has to be fought with strong human rights needs at the center, that there are no human rights abuses at the center, there's no discrimination and no segregation. If we do that, then we fail. We fail collectively. What do I mean by this? We need governance issues that we are seeing, we are hearing across in some countries just need to be addressed very openly. And we have to speak the truth about those without feeling embarrassed, that we condemn that collectively as a continent, that this is a human rights issue and this is a collective issue. We are at war with this virus. These are some lessons that we've learned. Then lastly is that our healthcare system as a whole, taking aside the human resources outlined, are very weak. And we need to take advantage of this crisis to come out better than we came in by building institutions, by strengthening our national public health institutes. That will become the pillar on which we will fight subsequent pandemics. Those are a few lessons that we've learned in the last 7 months, at least from the African perspective.
Thank you so much for clearly elaborating on that. And I couldn't agree with you more on your last point around strengthening the health systems, which actually brings me to the another question that came in earlier, and I'll pose this question to Rosemary. You know, we've heard and seen how COVID is putting a huge strain on health systems and the increasing demand for PPE, staff, and diagnostics, but also how COVID-19 has led to missed appointments and client engagement with the health facilities. And I know, Rosemary, you spoke to this area. So just with that in mind, how can Global Fund and PEPFAR work together to increase access to safe HIV, TB, and the malaria services?
Thank you, Maureen. So there are many things we could look at that question. I will focus on what we have learned and therefore what we must do. What we have learned is that in the HIV epidemic, we waited too long. The international community waited too long to get things right. The Ebola epidemic, the international community waited too long. For those two, we lost too many lives. COVID-19, we must not wait. We must do it now as it's happening. And one of the ways to do that, so there are many ways we could do that. One of the ways we could do that, and I'm thinking in terms of the focus of this particular conversation, is really around uniting. There are many ways to unite. One of the things that we are calling for is really for partners to unite in terms of the leadership in investing in the epidemic, in the pandemic. So we have the Global Fund, we have PEPFAR, we have so many other donors, and we have mechanisms that have been established that can actually, that are providing the leadership in ensuring that we are supporting countries to rebuild back. And in terms of rebuilding, we want to rebuild better. So some of the lessons we have learned by not investing, by not making adequate investment, we want to actually do that now so that we rebuild stronger, we rebuild better. And that can only happen when everybody puts in their commitment, their support through the mechanisms and frameworks that exist, such as the COVID-19 response mechanism that the Global Fund has put up, which, as we understand, unless partners rise and support by investing more, it could run out of money, which I think is not something we want to see. Thank you.
Thank you so much, Rosemary. There's another question that also came in, and the question is asking that, you know, the focus, so far the focus to date has been very much on those that are currently infected or measures to prevent the infection itself. But we are also aware of the fact that we know that the community of COVID-19 survivors is actually growing. So the question is asking, are there any ideas on what we should be doing to better support this group to sustain health and wellness? Maybe Ruaz, you can pick this up, or I can turn over to Dr. Nkenkeson. So both of you can take this question.
Hi, I had a cut in transmission there. Could you kindly repeat for me?
Yes, me too. It was a little bit not clear.
I'll repeat. I'll try to repeat. I hope can hear me now.
You
Yeah,
faded
so,
off again.
Can you hear me now?
Yes, you're back.
Okay, yeah. So the question is asking that at the moment, the focus has been very much on those that are currently affected, but also on measures to prevent infections. But we know that the community of COVID-19 survivors is actually growing. So are there any ideas on what we should be doing to better support this group to sustain health and wellness?
Thank you for that question. From the group that I participate in, there is a lot of, I think, therapeutic support with regards to long hauling. There's also, in South Africa in particular, there's a lot of people that are out of work. And so it's an economic issue that we are facing. And the sad part is there's children who've lost parents and now they have child-headed homes. So we are still trying to find, I think, a common ground as a group as to what it is that we are asking for. So at the moment, I can't really say for sure that this is the actual ask, but we are all dealing with all kinds of post-COVID issues. Yeah.
Thank you so much for that. Maybe I'll just pose one last question. Also looking at the time, we need to be done at least at the top of the hour. And this is a question that is, I'll pose this question to Dr. Nkengasong. The question is asking, is there anything that can be done at the moment to develop research capacity in Africa for Africans?
To develop what?
Research capacities in Africa.
Yes, I mean, it's a lot going on the continent, but it needs to be well resourced. I think that's where the partnership, the kind of partnerships that Chris mentioned is extremely important. I think you have the African Academy of Science that is doing a tremendous amount of work. You have very specialized research centers across the continent that are doing a lot of work and full with very capable Africans and researchers. The rate limiting block or step for most of these researchers and centers to function is is financial investment to make them truly function and explore their maximum capacity. I think I can name you a series of of centers that are in Africa that can do remarkable work. If you turn to West Africa, there are two wonderful Pasteur's institutes there, the Nguchi Institute, the Medical Research Council in the Gambia, the Nigeria CDC, and you turn to Central Africa, two Pasteur's Institute, there's the center in Gabon, Professor Muyembe's, the state-of-the-art lab in DRC, in Kinshasa. So what we are doing as Africa CDC is to create a network, what we call the Regional Integrated Surveillance and Laboratory Networks across the continent, that will all come together and harness those assets to promote research on the continent. So a lot of it has to do with the funding. I mean, and it has to start from within the continent. That is, member states recognizing that research is a pathway to development and investing in research and medical research or health research, and then the partners also investing into our continental agendas and such that there is no silos there. So I think I'm really hoping that COVID will be that catalyst, it will provide a catalytic mechanism to bring the research agenda to the fore.
Thank you so much for that. So like I said, there were quite a number of exciting and insightful questions that actually came in, but unfortunately because of time, we won't be able to get through all those questions on this call, but we'll try as much as possible to find a mechanism in which we can provide responses to all those questions. So with that, let me hand over to Mitchell to close this session. Over to you, Mitchell.
Great. Thank you, Maureen. LaWACI, Rosemary, Elizabeth, John, a remarkable conversation that we really hope continues. Impossible to summarize. but we'll be posting the recording, and we really encourage people to share it widely, because the things that were said on this call really can help define a collective way forward in not just the COVID response, but something that I think all of you talked about is the ability to rethink the national, regional, and global health architecture for the future. And Dr. Nkengasong, I think something you said really resonated about the opportunity to think about a true global fund for health, and not just thinking about individual diseases, because at their heart, whether it's the research infrastructure, whether it's the policy environment, and most importantly, something you all said, the community centered approaches, that is not about any one disease or health condition. It is about all that we do. So I just want to thank everyone, and maybe also just end with something also, Dr. Nkengasong, you said that I think we all take great hope in that this epidemic will be won or lost in communities, with communities, led by communities in Africa and around the world. I just want to thank you all. And we really look forward to multiple conversations going forward with all of you. So again, thank you so very much. Stay safe and well all. And please do keep your questions coming to WACI Health, to Friends of the Global Fight, to KEMRI, to Africa CDC, to AVAC. And we look forward to continuing that dialogue.
Through this.
Thanks again. Cheers all.
Bye all.
And feel better, Lawazi.
Bye, everybody.
Thank you, Mitchell.
Bye.